So let's answer the quiz contest for Friday, 7th of June 2024. So first thing you were to do was to read the instruction, then ensure that after you finish, you screenshot your results. So let's go ahead and answer the questions now. So let's start. Question 1 says, which of the following is a set of hydrophobic amino acids? Now, valine, methionine, and isoleucines are actually sets of hydrophobic. Now, in some textbook, methionine is classed under hydrophobic. Ideally, we have hydrophobic as being the hydrophobic aliphatic, that's the GAV-lip, glycine, alanine, valine, leucine, isoleucine, and proline, and the aromatic hydrophobic, which are the phenylalanine, tyrosine, and tryptophan, but some texts class methionine under hydrophobic, so that's why the answer would be this option. Question 2 says, a child with tall stature, loose joints, and detached retina is found to have a mutation in collagen. Which of the following amino acids is the recurring amino acid most likely to be altered in mutations that distort collagen molecule? The answer is glycine. Glycine is the one that helps the collagen molecule to have the kind of shape it has. Question 3 says, which of the following tests is not based on the reaction of carbohydrates with strong acid? And the answer is Benedict. Benedict, it's not based on reaction of carbohydrates with strong acids. Question 4, a woman who eats a standard meat-containing diet, which means she must have vitamin B12, has had one child born with neural tube defect and is considering becoming pregnant again. Blood work showed normal levels of B12 and the total folic acid. Specific types of folic acid are not specified. One possible explanation for the woman's difficulty in her first pregnancy is a thermolabile variant of which type of enzyme? She must have the enzyme called N5-N10 methylene tetrahydrofolate reductase, because if this is not working, she cannot be able to convert this to methinyl. So if you look back at the folate acid pathway, we need this enzyme to reduce methylene to methinyl, and then it's a methinyl that now gets converted to methyl, which is needed for the reaction of DUMP to DTMP. So this is why she must be having babies with neural tube defect. Question 5 says, which out of the following is this substrate specific enzyme? So we have lactase as being a substrate specific enzyme. It's substrate specific. The alpha helix rise pattern a distance of 0.5 nanometer. That's the correct one. Question 7 says, megaloblastic anemia has two most likely causes. So megaloblastic anemia has most likely causes: deficiency of folate and deficiency of cobalamin. Often treatment of patients with cobalamin deficiency improves in terms of their hematological features with treatment of folate, but not in their neurological features. What is the most likely explanation? Now, if somebody has vitamin B12 deficiency and we give folate, the blood features of B12 deficiency improves, because the folate, folate needs vitamin B12 for the methylation of DUMP to DTMP. But if we give a higher dose of folate, the excess folate blunts the trapping of folate as N5-methyl tetrahydrofolate. So that's the correct answer here. Question 8 says, the activities of many enzymes, membrane transporters, and other proteins can be quickly activated or inactivated by phosphorylation of specific amino acid residues. Now, if you recall, how does glucagon work? If glucagon binds to its receptors on let's say the adipocytes, now it will activates the signal transduction pathway of cyclic AMP, and the net effect is that a protein kinase A is activated, which will now phosphorylate hormone sensitive lipase, which makes it active. So you can see now that there's phosphorylation of a specific amino acid residue of that enzyme that makes it active. So it could either activate or inactivate it. So this method is called covalent modification. Question 9 says, which of the following mucopolysaccharide is not sulfated and most abundant in tissues? Hyaluronic acid is non-sulfated and most abundant in tissues. Question 10 says, an individual has developed pancreatitis and with it steatorrhea, which means he will not be able to absorb fat-soluble vitamins. The patient also reports problems with his night vision, which means vitamin A is already showing signs of deficiency. Although visual acuity appears normal, another expected finding in this patient would be which of the following. So the correct answer is easy bruising because of vitamin K deficiency. The rest are not related to fat-soluble vitamin deficiency. So this would be the most appropriate answer for this. So let's check if we got everything. So voila, we had 10 over 10. That's 100%. So I'll see you guys in the next Urgent 2K challenge next Friday. Please do also participate in the TAVAcademy Med Biochemistry monthly quiz contest coming up on the last Friday of the month. Alright guys.